Namaste. In this video, we will explain about the tracheostomy tube change.
First of all, let us know what is change of tracheostomy tube. Patient's tracheostomy tube needs to be changed after 72 hours, that is after every third day, to ensure proper ventilation and to reduce the rate of infection. In any case, if it is blocked before 3 days, you have to change it same time. Because of blockage, patient will not be able to breathe properly or sometime can die. So you have to know the signs of tracheostomy tube blockage. These are decreased air thrust, excessive sweating, labored respiration, use of accessory external muscles, look like difficulty in breathing. If these symptoms are present, then there is need for changing the tube. Points to remember: tube should not be changed immediately after the meal. The suction should be done before changing the tube. Articles required for the tracheostomy change: place articles on a clean tray or a table or a stool near the patient's bed. An appropriate size tracheostomy tube, new or cleaned. Size of the tracheostomy tube should be as per doctor's prescription. Check the tracheostomy tube for any damage. Lubricant gel for easy insertion and reduce friction and soft tissue injury to trachea. 2 pair of clean gloves or paper gloves. Some sterile gauze pieces in a sterile katori or bowl filled with normal saline or rolling boiled then cool water to clean the stoma. Ties or bandages to tie the tracheostomy tube. Scissors to cut ties or bandages. A syringe 10 ml to inflate or deflate the tracheostomy tube balloon. Suction machine to do suction if there is need of suction of the tube or tracheal opening in between. Normal saline or rolling boiled water which is cooled afterwards, pour that in a glass to do suction in between. Appropriate sized suction catheter to perform suction if required in between. A face mask, a small towel to cover chest to prevent cloth soiling. Dustbin to discard waste materials. Separate box to keep dirty TT tube. Steel container to store TT for the next use. Sanitizer to wash hands. Note: there should be at least 2 persons to change the tracheostomy tube. Step-by-step procedure of tracheostomy tube change. Wear face mask. Expose the patient tracheostomy tube. Assess the condition of the patient for any blockage sign. Keep the suction machine ready near the patient's bed. Wash your hands with soap and water. Inform the patient regarding procedure. Provide the extended position to patient. Spread the small towel over the patient's chest below the tracheostomy tube. This will protect the patient's garments. Deflate the balloon of tube with syringe while it is inside the trachea. Wash the hands with hand rub. Wear the first pairs of clean pair of gloves and wash the gloved hands with hand rub. Loosen the previous ties and then gently remove the tracheostomy tube. As soon as you remove the tracheostomy tube, patient may become restless. Keep yourself calm and quiet, and if need to do the tube suction in between. Remove gloves and discard them into the dustbin. Wash your hands with hand rub. Now wear second pair of gloves and wash your gloved hands with hand rub. After that, gently clean the stoma with wet gauze pieces. Now a second person will apply lubricating jelly on your gloved, non-dominating hand. Apply the lubricant gel on the insertion end of the tube. Now insert the tip of the tube from the lateral side into the stoma, so that its outer end should be parallel to patient's shoulder. As the tip of the tube enters the stoma, immediately rotate the tube 90 degrees downwards to the body. Then remove the stylet out. Do not force while inserting the tracheostomy tube. It should follow the healed path. Patient may become restless. Inflate the balloon with 4 to 5 ml of air using the 10 ml syringe. Check air is coming out of tracheostomy tube by putting your forearm in front of tube opening and assess whether patient is comfortable. Apply the sterile rectangular gauze piece dressing around the tracheostomy tube. While other person is holding the tube in one place, using dominant hand thread one end of the new tie into the eye of the tracheostomy tube of one side and tie it. Bring the other end of the tie around the neck of the patient to the second eye of the tracheostomy tube and tie it properly. Do not fasten the tie too tightly. It should allow one finger to move freely underneath. Remove the small towel from the chest of the patient. Now provide comfortable position to the patient. Apply sterile wet 2-layered gauze piece over tracheostomy opening of the patient. Clean the tracheostomy tube with running water. Remove deposits by using small bottle brush or with the help of stylet of TT tube. Remove the gloves and discard them into the dustbin. Wash the reusable articles with soap and cold water and then dry them in sunlight before replacing. Discard contaminated waste. Wash hands with soap and water.